Pregnant women led by health workers sing motivational songs and chant health instructions from memory. These women are beneficiaries of the free primary healthcare initiative of the MDG's office and National Health Insurance Scheme.
No matter wherever you are coming from, even if it is not from Ibadan Southeast local government, as far as you are a pregnant woman and you are carrying a baby that you have just delivered from 0 to 5, you are free to register and the treatment is free.
Everything is free here. We do weighing, blood tests and the rest, and we don't pay at all.
Shakira Adeleke is 30 years old, pregnant with her fourth baby. She is here today for her routine checkup. Then she joins the other women for a singing and dancing exercise. Health workers then step in to teach the women some healthy practice.
We let them know that food is very, very important for the babies, and then we just supplement with the multivitamin drugs and get their immunization at the right time they're supposed to get their immunization.
We have been taught how to make oral dehydration therapy, which I didn't know how to make before. They also taught me how to prepare nutritious food.
Shakira really appreciates the free services she gets here. Now she wishes that free food and beverages could also be provided.
Now we want beverages, milk and food.
Health sector reform and the National Health Insurance Scheme are making impacts with the introduction of the Community Health Insurance Scheme in 6 pilot states, with a focus on pregnant women and children under 5. The program is working and has more room for more beneficiaries if only they show up. 12,000 rural people in Ibadan South are registered so far. The Health Maintenance Organization has been paid over 9 million naira by the MDG's office through the NHIS since the initiative kicked off. The National Health Insurance Scheme has been referred to as the fastest growing social health insurance initiative in the world.
We have covered 1.5 million people, that's here, pregnant women and children. And actively now in our data, those who are actively accessing care there are about 1,400,000 women and children. Some have exited, and in that it's a dynamic thing. People are being registered, some are exiting because they are delivering, and after 6 weeks the cover is finished for the pregnant women. But then you pick the children for the next 5 years. So that's how it's working.
The success of that has been to properly get the baseline data right, target the communities, give local governments responsibility, and it took a while to get an agreement with the local government in seeing that we reach our objectives. Advocacy for people to know that these facilities are available and to reach really those that are not reached. And what has happened is that because we put them in communities, we have involved HMOs, we have raised the standard of service in a primary health care center or a hospital, a medical facility. It's not just provided now health facilities for pregnant women and children under 5. Others are coming in as well to access those services. So I think some of the pluses that we've had is that we've opened up areas, communities have got involved when they've seen the results from the healthcare. It is certainly a project that has borne a lot of fruit for us in its initial stages. We have made further tracks by linking it to what primary health care are doing. Some of the challenges we had in the past is that government agencies not working together. But today I can say that in the health sector you see a very clear partnership between the Health Insurance Scheme and Primary Health Care Development Agency.
Over 5 million Nigerians currently benefit from the health insurance scheme with no contribution for the last 5 years. Billions of naira has also exchanged hands in that time. The MDG's office is helping various governmental establishments for the continuous capability improvement of health institutions, including hiring and training of health personnel. Nigerians, both young and old, are also being provided with knowledge to help combat disease and achieve the Millennium Development Goals on health. The MDG's office is collaborating with federal and state governments in Nigeria to advocate for the adequate primary health care. However, many are saying there needs to be involvement of the state governments in MDG initiatives.
Education itself is a challenge for us today in the country. So assuming that a child will begin to know their rights when education itself is a difficulty, is one thing to address. But what has been clear is we've recognized the link between education and health. And it's not just about mothers, it's about children. So having those discussions for nutrition, for hygiene in primary schools is something that's become part of the education curriculum. And so that you can see the linkages that are made there. Children will begin to learn right from primary school what those rights are and what it is that they can do at home that will help in enhancing their healthcare status. That's one side of it. The other side is we did try something in this office that has been quite successful, and we hope to launch that next week. And that's the MDG children's book, and break it down for them exactly what these MDGs mean and how they can contribute to it.
Many believe the country is still on the track to meet the MDG's health targets. The infant mortality rate rose from 81 per 1,000 live births in 2000 to 86 per 1,000 live births in 2007. However, progress has been noted in the proportion of 1-year-olds that have been immunized. Nigeria is still working hard to overcome some of the challenges facing these goals. Access to adequate primary medical care was quite a huge challenge in the past years. In the recent past, the MDGs has helped change the situation with the provision of well-equipped primary health care center in most of the hard-to-reach areas of the country. Many are singing songs of praises to the Office of the Senior Special Assistant to the President on MDGs for its hard work. The MDG's office has vowed not to relent on its efforts towards the achievement of the Millennium Development Goals, especially the ones that are critical to the development of the nation.